Good afternoon, I'm Micah Gigido and I will be demonstrating how to insert nasal cannula. So first, that you're going to do is introduce yourself to the patient, um, wash hands and observe appropriate infection control procedure, explain to the patient what are you going to do and why is it necessary, provide patient privacy such as pulling on the curtains and closing the door, and last is explain to the patient on how he or she can help you in the procedure. So first is, after that is assemble all the materials that you're going to use, such as the nasal cannula. So next is introduce yourself to the patient. So good afternoon, ma'am. I'm Micah Gigido and I will be your student nurse for today. Can you state your name?
I'm Alexa.
So ma'am, I will be going to insert nasal cannula. Is it okay?
It's okay.
So after that is assemble all the equipments that you're going to use, such as the flow meter. Assuming that this is the flow meter, make sure that the flow meter is closed. Next is humidifier. Put tap water in the humidifier, but some humidifiers have already a water because of the manufacturer. So next is attach the humidifier into the flow meter, and then attach the end tubing of the nasal cannula in the flow meter and humidifier. Assuming that you have connected the end tubing into the humidifier, next is check the tubing if there is no any kinks, and if you turn on the oxygen tank, the oxygen or the air must be flowing into the tube so that you may know that it is working. And then the humidifier must have bubbles. And then nasal cannula can give or release 2 to 6 liters of air or 24 to 45%. And if the nasal cannula's oxygen exceeds to 6 liters, the patient will swallow the oxygen. So next is insertion of the nasal cannula. So first, insert the nasal prongs into the nose of the patient. And then put the exceeding tubing under the patient's ears. And then if you don't want to move the tubing, you can put tape into under the client's ears, and then this adjustable strap or the bolo, it can help you to adjust or tighten the tubing under the client's neck. Not too tight and not too loose. Done. Good morning, I'm Micah Gigido and I will be demonstrating how to give or how to put face stent to our patient. So first is introduce yourself to the patient. Explain to the patient what are you going to do and why is it necessary. Next is assemble all the materials that you're going to use. Wash hand and observe appropriate infection control procedure. Provide patient privacy such as pulling on the curtains and closing the door, and also explain how the patient can help on the procedure. So first is introduce yourself to the patient. So good afternoon, ma'am. I'm Michael Gigido and I will be giving you or putting you face stent. So can you state your name?
I'm Alexa.
Ma'am, I will be giving or putting you face stent for you to have a better lung expansion. Is it okay?
Okay.
Next is assemble all the materials that you're going to use, such as the face stent. Assuming that this is a face stent. Next is face stent can be given to the patient who can tolerate face masks, and Face tent can give 30 to 50% of oxygen and 40 to 8 liters of oxygen to the patient. But before inserting or giving this face tent, you need to assess the patient's face if it has any redness in the face, any lesions, chapping, or dryness. And then after putting the face tent to the patient, observe if there is any tachycardia or any loss of oxygen, hypoxia. And then after that is give the face tent to the patient. Make sure that the face tent are exact to the patient's contour so that the air from the face tent will not go out to the patient's face from the nose and into the mouth. After that is put the rubber into the client's behind the client's head. Good afternoon, I'm Maika Gigido and I will be demonstrating how to give incentive spirometer. So incentive spirometer is a good tool to keep airways open and for the patient to avoid having pneumonia and to have a better clear airway of the lungs. So first that you're going to do is introduce yourself to the patient, explain to the patient what are you going to do and why is it necessary. Next is wash hand and observe appropriate infection control procedure. Next is provide patient privacy such as pulling on the curtains and closing the door. And then last is explain to the patient how he or she can help to the procedure. So next is introduce yourself to the patient. So, good afternoon, ma'am. I'm Maika Gigido and I will be your nursing student for today. So, can you state your name?
I'm Eliza.
So, I will be teaching you how to use incentive spirometer for you to avoid having pneumonia. Is it okay?
Okay.
So, next is assemble all the materials that you're going to use, such as the incentive spirometer. So, assuming that this is the outlet or the incentive spirometer and this is the tubing or the mouthpiece. So next is put the patient in a sitting position. Can you see it? Assuming that this is the incentive spirometer and this is the outlet or the mouthpiece tubing, explain to the patient that the patient needs to deeply breathe from or blow from her mouth and then exhale it inside the incentive spirometer. So, ma'am, can you inhale from your mouth and then exhale slowly to the incentive spirometer and then wait for the piston to rise. After that is document where the piston or the ball rise and then ask the patient that the incentive spirometer she can bring the spirometer at home for her to have more results and repeat the incentive test 10 times and then record it into her diary because it can detect there if the patient is highly. Good afternoon, I'm Maika Gigido and I will be demonstrating on how to give or to put face mask to our patients. So first is introduce yourself and explain to the patient what are you going to do and why is it necessary. Wash hands and observe appropriate infection control procedure. Next is provide client privacy such as pulling on the curtains and closing the door. And then last is explain to the patient how he or she can help you to the procedure. So first, face mask can give more oxygen to the patient than the nasal cannula. It has 5 to 8 liters and can give 40 to 60% of oxygen to the patient. So, next is introduce yourself to the patient. Good afternoon, ma'am. I'm Micah Gigido, and I will be your student nurse for today. Can you state your name?
I'm Nicole.
Ma'am Nicole, I will be inserting face mask to you. Is it okay?
Okay.
Next, what you're going to do is you need to assemble all the equipments that you're going to use, such as face mask. So, as also like the nasal cannula, assuming that this is a flow meter, you need to turn it off and then put water in the humidifier and then insert it into the flow meter. And then after that, insert the end tubing of your face mask into the humidifier. Next is, once the end tubing are connected in the humidifier, you need to check the tubing if there is no kinks, and then insert the another end of the tubing into the face mask. After that, you can know, or you may know, if the humidifier or the tubing is working. If the humidifier has bubbles and the tubing, you can feel that the tubing has airflow through it. And then, give it to the patient. So, make sure that the face mask is properly put into the face contour of the patient so that no little air are coming out of the face mask. You will insert the face mask first from the nose and then from the mouth. And then put the band under the client's head. Good afternoon, I'm Micah Gigido, and I will be demonstrating or instructing the patient on how to use expiratory flow rate or peak expiratory flow rate. So first, why is it important? It is to measure how fast a person can exhale and commonly perform at home and document it regularly. So first is introduce yourself to the patient, explain to the patient what are you going to do and why is it necessary. Wash hand and observe appropriate infection control procedure. Next is provide patient privacy. And then last is explain how the patient can help in the procedure. So first is assemble the materials for assuming that this is a peak expiratory flow rate. So next is introduce yourself to the patient. So good afternoon, ma'am. I'm Micah Gigido, and I will be performing, or I will help you to use the peak expiratory flow rate. Ma'am, can you state your name?
I'm Eliza.
Ma'am Eliza, I will be helping you to use peak expiratory flow rate. Is it okay?
Yeah, of course.
Next, then ask the patient to take a deep breath, and then if tolerated, and then tight seal to the mouth, and then blow as fast as possible. So first is, assuming that this is a mouthpiece, insert the mouthpiece into the peak expiratory flow rate, and then make sure that the dial is back to this. Instruct the patient to seal the mouth around the mouthpiece and then exhale as fast and hard as possible. So, ma'am, can you exhale fast and hard as possible? After that is document the findings